Good morning. Welcome to Active Aging with Barb. My name is Barb Eisenberg. I'm a physical therapist assistant and also a licensed massage therapist. I work with a team at Therapy at Home where our passion is to inspire seniors like you to live happier, healthier lives so you can age successfully and independently with a positive attitude. So together we can create possibilities as we get older and better. This is June. It's National Safety Month, so I'll talk for a few minutes about fall prevention. Then we'll get moving with the exercise program to lengthen and strengthen as many muscles and joints as possible, mobilizing as many joints as possible, keeping them nice and limber. So this information is for educational purposes only. It's not meant to diagnose or treat any specific condition. If you have questions about your own body, make sure you check with your healthcare provider. They know you best. I have a little announcement. We're going to have a big change this summer. Instead of having these videos live twice a week, we're having these videos once a month, the first Tuesday of the month. We'll have these live videos. We'll still continue to have videos, lots of videos available online, so you can pick any of those you want. Anytime you want to do a video, you just pick one out. But the live is going to be the first Tuesday of the month. So we'll see you again live July 6th. And then keep watching, because in the fall we have something big coming up. I'm not telling what it is, so keep watching. So why should we be concerned about fall prevention? Falls after the age 65, 1 in 3 Americans will have a fall every year. It's a very terrible statistic, and more concerning, falls are the #1 cause of injuries for older Americans. So we really want to prevent them as much as possible. More concerning, Wisconsin is the #1 state for deaths from falls in the country. It's a terrible thing. We really need to work on that and get off of the top of that list. We don't want to be #1 in that. So falls, even if they're not fatal, they can lead to long hospitalization, long recovery period, and it could lead to a loss of independence. And we all want to stay independent as long as possible as we get older. So what can we do? Lots of things we can do. 2 things: we can change our environment. We can also change our bodies and how we move, improving our balance reflexes. So some of those risk factors that we can change: poor eyesight, poor lighting, clutter in the hallways or in the stairways. These are things we can really take care of and easily remove those risk factors. Another one is a fear of falling. And again, it's not inevitable. What you do if you have a fear of falling, you work on your balance reflexes, you improve your confidence, and reduce that risk of your fear of falling to reduce your risk of having a fall. So, besides the risk factors, we can work to improve our balance reflexes. The best way to do that is to get an assessment by a physical therapist. They can look specifically at what needs to be worked on. There's lots of different ways that we can improve our balance through strength and specific exercises for different parts of our balance. We use our eyesight, we use proprioception. So a physical therapist is the best person to really design exercises specifically for you, but I'll just give you a few ideas today. Some of them standing still and some of them in moving. So first, you want to have a safe place. You want to have a counter, or I usually use a chair for balance. You can work in a hallway where you have 2 walls to use for your balance. And then a simple thing to do to start challenging your balance is just to instead of having your feet wide apart, put them together. Narrowing your base of support will challenge your balance. So first, try that. Hold on to the chair if you need it. Gradually let go with one hand, and then eventually, hopefully, you can stand feet together, not using your anything for balance. So that's great. Then you can try a semi-tandem. That means you're just putting one foot a little bit ahead of the other foot. That challenges your balance even more. Then gradually try to reduce that support that you have. And then if you want to make it harder, put your heel to toe. That's like you're standing on a tightrope, even harder. You're going to see my ankles are wiggling. That's my balance reflexes. Might have to bend my knees a little to get the balance back. Might see my hips moving. Tandem stance is a big challenge. And a little harder is standing on one foot. So eventually you start with two hands, gradually go to one hand for support, then eventually you want to try to let go for a few seconds, and then hopefully your goal is to try to work up to about 30 seconds standing on one foot. Ankle will wiggle, you might have to wobble it and wave around. That's all part of your balance reflexes. Okay, for some moving exercises, you can step side to side or just step all the way down the hallway. You can step backwards. So remember, when you're stepping backwards, you go toe to heel. It's the reverse of walking forwards, where you go heel to toe. So you reach back with your toe and take a step. So reach back, take a step, reach back, take a step. Good balance exercise. And if you want to go a little bit harder, then you do that tandem, but you're going to walk with that like you're walking on a tightrope. Very difficult. Keep challenging your balance. Don't worry if you wobble, if you stumble a little bit. As long as you're staying safe, you're really challenging those balance reflexes, and they will get better. Just like a muscle, if you work them, they get stronger. So falling is not inevitable as we get older. We can continue to have good balance, and we can improve our balance if we keep working at it. For our next video, July 6th, our next live video, we're going to talk about strong hips and how important they are and what they can do for us. If you have not exercised for a long time or never had a regular exercise program, check with your healthcare provider. If you start exercising and you start feeling dizziness, lightheadedness, shortness of breath, stop immediately and get checked out before you continue. So we always start with a warm-up. Let's get started. So I'm going to start by just swinging and rotating around my spine. Our spines often get very stiff from sitting or just moving in a stiff way. And we want to loosen up that spine. We don't want to get backaches. One of the biggest concerns in America, one of the most common pains, is a low back pain. So we got to mobilize that spine. Swing from side to side and arms up. Take some nice deep breaths. Big swings. Arms are connected to our back, so when you work the arms, you help lengthen the back. Nice job. Swing the arms. Up and up. Up and up. Up and up. And let's go around again. Swing all the way around. And we're not working real hard yet. We're staying relaxed. The muscles have to loosen up to let the blood flow and let the oxygen flow into those muscles. Now let's swing down, shifting the weight. Now I'm feeling in my hips a little bit, shifting side to side. Breathing deep. Reaching to one foot and the other foot. Reach and reach. So we're still rotating around the spine, but we're also shifting our weight. You should be feeling it in your hips. Shifting side to side. Pretty simple movement, but very powerful. One arm up and up. And up, up, and up. Other arm up and up. Big movements. Now let's do a big circle. 2, 3 circles, other arm. 1, 2, 3 circles. 1, 2, still using my legs, bending. When you pump those legs, you really use those large muscles. Now let's do up and down. Swing up and down. Really reach and reach. Anytime you lift your arms above your head, you're going to increase the blood flow, increase the effort, increase your heart rate, which makes it more of a cardio workout. So we're strengthening the heart and the lungs. Deep breaths. Up and down. All right, now reach with one and the other. So we're just wiping the ceiling. Wiping the ceiling. Slowly working our way down. Wiping and wiping the air. So now I'm working my shoulders, working the stomach, the core. When you're bending, your core is holding you up. And we're loading up the quads. Gradually working your way down. Reaching as far away as you can. And then work your way up. Working up. Big flowing movements. Good job. And all the way up to the ceiling. And reach. And reach. Now we're turning it into a little bit of a lunge. And up. Little side lunge. So when you go to the side, you're loading up the core. These are all the core muscles holding you up. And this long arm is lengthening the ribs, which is strengthening the back. Reach over and come up. Now we're going to do a little pull. So reach and pull, reach and pull, reach and pull, reach and pull. Other side. Reach, reach and pull. Reach. So we're loading the quad muscle, loading the core. If it's too much with an arm up, you can just do arms on your waist. Not as big of a load on your core muscles. Here, you're increasing the load. Good job. Now we're going to reach forward and pull back, forward and pull back, forward, back, forward, pull back. We're going to loosen up that shoulder now. So we like to do a big figure eight. One of my favorites, because we're loosening the shoulder joint, but we're rotating around the spine. So we're mobilizing that spine that gets so stiff from too much sitting. Big circle in the front and the back. Big circles. Other arm. Big circles. Circle in the front and circle to the back. So you're turning your shoulder over and then you're opening it up. Working the front of the shoulder and the back of the shoulder. Good work. You should feel that shoulder loosening up. Now we can do both shoulders together. So elbows back, elbows out, then reach forward and lift up, open up. Always trying to work posture, which means you're opening your chest. Let's go again. Bend your knees, elbows go back, then out, then coming forward, really rounding your back, feeling it in your lower back and your ribs, then lifting up and open wide. Good job. One number at a time. Elbows back and out, pulling forward and lifting up. Open wide. Good job. Now we're just going to be doing some pushes. So you're pushing like you're pushing a heavy object away. But when you push in one direction, you're pushing in the other direction with your back. So we're really trying to loosen up the back, pushing from one side and working our way over to the other side. So you're pushing and doing a big lunge, then we're pulling back and up. Open that chest again. Now let's push in the other direction. So push and push and push. Knees are bent. Push to the front. Work our way around to the other side. Push and push. Now we're doing a little lunge to the other side. Reach out and pull in. Lift up and open that chest. Good job. Do it again. So pushing, little pushes, rounding the back, pushing back in the one direction, hands in the other direction. Should feel this in your lower back. Pushing away, pushing all the way to the side, and then pulling back, lifting up, and open up the chest. One more time, pushing away, push, and push, and push, and push. There isn't anything there, but if you push and you feel the resistance, you're working. Push as far as you can, pull in, and then lift up and open up the chest. Good job. All right, let's do some work on the legs and the hips. So we're going to go wide base of support, lower down for 3, and then come up. So we're lengthening these quad muscles and then strengthening them. And up. So when you go down into this knee bend, your knee's supposed to stay over your ankle to protect your knee joint. Force your knees out to work the glutes, and then come up. So down for 3, and up for 1. Down for 3. Up. Down for 3. And up. You decide how low you want to go. You want to stay in your own comfort zone. And up. Working these quads. Strong quads will help strengthen the knees. And up. Now we're going to add some arm work. So arms straight out. And up. Pull down. Reach up. Pull down. Reach up. Pull down. Reach and pull. Now let's stay down and do some pushes. Push to the front. Push to the front. So again, we're working that back. Lengthening. Now let's pull back. And pull back. Push down. Push down. Push down. Push down. Now pull up. And pull up. Reach and pull. Reach and pull. Now let's reach to the back. Reach to the back. Working the core now. Reach to the back. Reach to the back. If your legs get tired, just shake it out and start again. We're really, these quad muscles can handle a lot of work. Reach to the front and front and front. Pull back, pull back. Reach up and up and up and up. Whew. Should feel a little bit of a burn. That's perfectly normal. So just shake it out. And we'll do a little more hip work. So legs straight out. Let's do a flexed foot and lifting up. 3, 4, 5, 6, 7, and 8. You may think, turn it out, toes pointing forward. We're just working a leg, but if you stabilize your core, you're working the core as well as the leg. And you're also working the leg you're standing on because that leg is stabilizing. So it's really almost a full body workout. Arms aren't doing a whole lot here, but a lot of core, a lot of leg and hip work. So toe pointing up, and we're lifting 7 and 8, and then to the side. Keep your knee pointing forward and lifting up to the side. Doesn't have to go very high, as long as you're engaging these hip abductors. 7 and 8. Good job. Now come to the front, bend the knee out, and lift it up. Now we're working the inside of the thigh. You want the hip to be strong in all different directions. And then to the back. So knee is bent, and lift it up a little bit to the back. 4, 5, 6, 7, and 8. Other side. All right, so to the front, lifting up. 2, 3, 4, 5, 6, 7, and 8. I think we did this side already, so we'll turn the knee out and lift up for the inner thigh. 4, 5. This one is harder. We don't use these inner thigh muscles that much, but we really need to keep them all strong. 7 and 8. And then to the back. So knee is bent, but you're using these hip extensors, so lifting just a little bit to the back. 4, 5, 6, 7, and 8. Good job. All right. Let's go back to arms, but if you want to add the legs, you can do this in a little plie. So we're pushing out using these elbow extensors, these triceps, place that gets a little flabby as we get older. If we keep working it, we can reduce that. Pushing to the front, pushing up, pushing out, pushing down. Now let's go the shoulders, so hands pointing forward and lifting up. 4, 5, 6, 7, and 8. Fingers pointing up and pull back. Elbows are straight now. 3, 4, 5, 6, 7, and 8. Now let's do a circle and around, loosening up and around. 5, circle around, and 7, and 8. All right, let's do a little bit of a plie, and we're going to work the calves and the quads at the same time. So toes are pointing out, knees in line with your ankles, hands on your hips, and lift your heels. It's a little awkward at first. You might need your chair because it's a little bit hard on your balance. Just try to lift those heels. Not something that you might expect, but we're working the calf now. We don't want any muscle to atrophy, so we have to keep using them. Just that old saying, if you don't use it, you will lose it. That is true for your muscles. Lift the heels. 7 and 8. 8, 7, 6, 5, 4, 3, 2, 1. Drop. 2. Drop. 3. Drop. 4. Drop. 5. Drop. 6. Drop. 7. Drop. 8. And drop. Whew. Little burn there. That's perfectly normal. All right, let's do a little more work on the calf. So if you want to load it up, let's do 2 feet together first. So lifting up on the toes and lower down. Then bend the ankles and bend the knees. Up and up, down and down. Up and up, down and down. If you want to make it a little more challenging, then you go to 1 foot. So up and down and bend the knee, straighten the knee, lift up, down with the heel, bend the knee, push up. So you're really loading that quad. And down, bend the knee, and up. Lift the heel and bend the knee. Other side. Bend the knee, straighten the knee, lift up on the heel, and bend. Up and up, down and down. Up and up, down and down. Up, up, down, down. 1 more. Up, up, down, and down. Good job. Let's go back to some core work. So we're going to do a little lunge to one side, reach out with one hand, trying to have a long line from your fingertips all the way down to your toes. The other arm is going to reach out like you're placing a ball on the other hand, and then lift up and around. Let's do that again. Reaching up, place a ball. Now the other hand's going to reach down, big circle around, place the ball on the other hand. Keep that hand there, reach down, big circle, and reach. Other hand, loading up the leg and the core, big circle, place the ball. Big circle around, come up, place the ball on the hand, other hand goes down, big circle, up, and place the ball. Now reach and pull in, lift up, and open that chest. Always working on the posture. Let's face the other way. So a little bit of a lunge, reaching out with one hand, reaching up with the other. Lift that ball, place the ball, other hand goes down and reaches up. Place that ball. So this is like a windmill, reaching up and place that ball, other hand, big circle, up, place that ball, reaching down and up. Place that ball, reaching down, up, place that ball. Now grab something and pull it in, lifting up and opening the chest. Good job. All right, let's do a little stretches for those hips that we've been working. I like to use a chair. You can use the floor if you'd like. Place the foot on the chair. We'll start with it bent, coming forward, trying to keep that back leg straight, stretching out the calf and the front of the hip, and then shift back. So just loosening up first. Forward, bend the back knee, straighten the front, bend the front, straighten the back. Shifting back and forth. Forward, feel a stretch in the front of that back leg, and shifting back. Now we're going for the hamstring here. You can pull your toes up and down, stretching that hamstring. Make sure you keep your chest up. If you round your back, you lose most of that stretch. And then if you turn your toe out, you're getting that IT band. It's a long band of ligaments. Can get very tight, even lead to some knee pain if you don't have a little bit of flexibility there. So turn the toe out and come forward a little bit. Should feel a strong stretch along the outside of that leg. Bend that supporting leg. Other leg, straight out, toe pointing up and down. And then come forward. Deep breathe. Then shift your weight forward. Straighten out the back. Feel that little psoas muscle. You want to stretch that little muscle. And then big hamstring stretch. Shift forward. And shift back. One more time. Shift forward. Feeling it really strong in that hip flexor here, and shift back. Chest is up. Turn the toe up and sideways to get that IT band stretch, coming forward a little bit. Feeling the outside of this leg. And hold. Good job. We want to make sure we get the quad muscle. We work the quads quite a bit, so come forward and then bend that back leg. Now we're stretching the quad muscle. Good job. If you straighten, you stretch the little hip flexor. If you bend it, you're getting the quad stretch. And other side. Coming forward, bend that supporting leg to get the quad. And straighten to get the hip flexor. Should feel good. Bend the knee to get the quad. And straighten to get the hip flexor. Nice job. Now we got to stretch the calves, so heel goes back and try to press it into the floor. Straight leg gets the big calf muscle. Shifting back gets the little calf muscle, that soleus or the Achilles tendon. And other side. Toe back. Try to press the heel down to get the big calf muscle. And shift back to get the little calf muscle, that Achilles and the soleus. Very important. If you have a blockage or an area that's really tight, other muscles will try to take up the slack, and it could lead to some pain. So let's do a little balance work. That sidestepping is a great one to do. Strengthens those hip abductors. You want to be able to move fast and slow for good balance and for just good muscle health. You don't want to just be able to move slowly. You want to be able to move quickly as well. Forward and backward, forward, backward, forward, backward. And with the other foot, forward. You can do it with a tap. You can do it with a lift, making it a little bit harder. Not even putting your foot down. You go to your level and then you work up from there. Don't try to compare yourself with anyone. Just accept what your body can give you today and then see what happens. Don't be too hard on yourself. Doesn't do you any good. Side to side. And I'm going to hold on to the chair for a little bit of balance. Great exercise for balance is to do some letters with your legs. So you're making a letter. I'm making an A, B, and C. So working your balance, working your hip strength. Other side. Draw an A, a B, not easy, and a C. Good job. And another great balance exercise we talked about is just standing on one leg. Try to let go for a few seconds or keep holding on if that's what your body needs at this time. Keep holding on to the chair. Gradually try to let go with one finger. Try to hold maybe with just a couple fingers. Standing tall, trying to tighten up the core. The tighter you are around the middle, the better your balance will be. And other leg, single leg. Standing tall, holding that core nice and tight. Almost finished. Let's take a couple of nice deep breaths, release any extra tension. Reach up and blow it out. Reach up and blow it out. Thank you for joining me. We'll see you live in July. Keep watching those videos. Bye-bye.